We're broadcasting from the Middle Tennessee Electric Studios.
MTE.com.
Middle Tennessee Electric, serving to make life better since 1936.
This is the WGNS Action Line. Talking with Rutherford County newsmakers
since 1947.
Now, your host, Scott Walker.
This morning, we're going to be talking about a back-to-school event, Back-to-School Bash, coming up on August the 8th, which is a Saturday. And we got Brandise Raikes, Director of Marketing and Communications at Murfreesboro Medical Clinic, and then also Lucie Bur, Physician Relationship Manager for Ascension St. Thomas Rutherford, Deputy Laura Kuntz with the Rutherford County Sheriff's Office. Back-to-School Bash, August the 8th. What grades and all of that are you expecting to see out there?
We would love to have all of our kids from Rutherford County. We're hosting it at our newest location on Las Casas Pike to make it convenient for those folks on the eastern side of the county and Kittrell and Las Casas, those places. But all ages are welcome. We're going to have lots of really fun things for kids to do and some fun giveaways. And the Sheriff's Office is going to be there doing free car seat checks for infants, toddlers, and of course you have to do booster seats until you're like
9 years old.
So toddlers,
yeah.
are they driving out there themselves? Yeah.
Oh,
Hey,
no.
How's the seat?
No, but we have a lot of parents that come to us. We do car seat checks pretty much on a daily basis. So if you call and schedule an appointment, we'll do it at the Sheriff's Office. But when we do these events, it brings that to them. It makes it more accessible for people to make sure that they're putting their kids in the car seat safely.
How often are the seats in correctly?
It's a pretty high rate. So it's a 40-hour class to be a child passenger safety technician. And then to be an instructor, it's even more complicated. A lot of the times it's just little stuff where the seatbelt's placed on their chest or not knowing that you need to lock off the seatbelt when you're putting in the car seat. It's little things, but that's what we're there for, is to educate the parents so that in the future they can do it on their own. They have the tools to do that.
Yeah, you have to have a degree in like rocket science to put car seats in.
Or pack and place.
Pack and place too, yeah. And then unfolding those strollers today. I don't know why all of those things are so much more difficult today versus, 20, 30 years ago.
They're just fancier.
The car seats will swivel in
They do swivel?
in the car so that you can, instead of reaching in to put them in, you turn it.
That's really cool.
Put them right in.
That's really fancy.
That's got to make it a whole lot easier.
Yeah. So we've got our pediatrics department will be there. We've got some pediatricians that are moving to Las Casas Pike at the end of the year, beginning of 2027. They'll be there. We are going to do a build your own boo-boo kit station where kids get to build their own little first aid kit that they can hang on their backpack. And
they'll enjoy that.
It's super fun because the process, they work with a pediatrician and they get to learn how to kind of care for a little boo-boo, like how you have to sanitize your hands and you have to clean the boo-boo and put on some antibiotic ointment and do the Band-Aid. And then, of course, every boo-boo kit has to have a lollipop and a sticker.
Kids are so funny, too.
Yeah. So. Parents love those too because they can clip them on a diaper bag or throw them in their purse and they've got something handy. We've got some other businesses that are going to come and do giveaways and games and things like that. And then I know Ascension has got some fun things planned. Really, we just hope that it's a morning that the community can come together. We are going to give away some school supplies for kids, provide some educational opportunities. It's going to be fun. We're going to have food trucks, ice cream.
You said ice cream will be there?
Yeah, ice cream will be there.
All right.
So it's going to be really fun, and we hope that we have hundreds of kiddos and their families there.
And that brand new location of MMC on Las Casas Pike, that's the first big, doctor's office out there, isn't it?
It is. And from what we've been told, the community is really excited. We've got patients that were having to drive kind of across town, which in Murfreesboro traffic feels like the other side of
drive.
Yes, Murfreesboro is an hour from Murfreesboro.
It feels like
to be able to get there quickly and have access to health care where they live is really exciting. And then we're really excited that Ascension is going to be joining us over there in that area to provide a standalone ER to that area of the county. That will be really life-changing for our community.
The standalone ER, is that already under construction?
It is not.
Okay.
So we just recently got our certificate of need. We'll be finishing all of those details and getting our groundbreaking going, and then we will begin construction. And to Brandise's point, we're just thrilled. We know the need was out there, and to be able to partner with MMC on that property should make the community feel confident and proud that we are trying to work together to make sure there's comprehensive health care closest to you in your community by your local community partners. That was another reason. It was just, there's going to be so many opportunities for us to partner out there, and we're just tickled about this back to school bash. We'll have, since it's going to be an ED, an emergency department, we're going to have our emergency department folks out there doing some fun activities, stop the bleed, and different things about injuries, and then having some giveaways and just be with the community. To Brandise's point, we've had some community meetings out there, and we know that they're excited and we know the need, and we're thrilled to be able to be out there together.
You know, for the longest time, like when I was in school, elementary, high school, all of that, it was like when you drove to Las Casas, you were really out in the country. I mean, it's like one house every 20 miles, it felt like. It's totally different out there.
Right.
New neighborhoods are popping up.
And we were really excited. So I know Laura had said they did this back to school bash last year. So when she approached me this year and said, hey, we did this thing. Do you want to work together? Yes. Like, let's do this together. We love working with the sheriff's department on lots of our initiatives. We've done car seat checkpoints with them in the past, as well as drug takebacks with Prevention Coalition. So we're really excited to partner with them and Ascension to bring a fun event for the community out there.
I bet the sheriff's department always gets like random weird questions at events like this. Especially new parents, they always have something odd, I'm sure, brewing.
Yeah, or you get the parents who are like, my kid doesn't want to go to school. Can you tell him you're going to take him to jail if you don't? And we don't. Let me just say, we don't do that. We don't want to scare them. We want good, positive interactions with your kids.
That would have been like a 1980s thing.
The
jail
scared
time.
straight stuff. Yeah.
So that no longer happens. You don't threaten jail time.
No.
But you do need to go to school, kids, if you're listening.
That's right. With, I guess, mainly it is the newer parents that you're interacting with at events like this for the car seats and stuff. Do you ever have parents show up without a car seat altogether and they're like, I can't afford one. Where do we go to get one?
Yeah, so we definitely do have that happen. We have people call as well. We do get state funding that allows us to give away car seats. However, they do have to meet a certain need requirement, so there will be paperwork that we would have to ask them to complete or provide. We have some. The thing is that it's best to call ahead and call the sheriff's office if that happens, because we have them set aside, and we just make sure that we have some in stock specifically for your child's needs, so age, height, weight. And if we don't have it, we'll reach out to Murfreesboro Police Department or one of our fire departments to see if they have any in stock.
So don't drive your kids out there sitting in a regular seat, not in a car seat, asking for a child seat.
We have other ways to get car seats as well. We have kids in devastating situations, which we can always go to that if it is something that is beyond what the car seat program can do.
I think when we've done car seat checkpoints with them and with Murfreesboro Police Department in the past, one of the things that I witnessed most often were parents whose kid was in a seat, but it was just not the right kind. Or some kids that really still needed to be in a seat were in a booster, or some kids that needed to be in a booster weren't in one at all. And then just the complication of making sure it's anchored, or I still don't know how to do it. I should probably pay attention. I have no need for a car seat at this point, but I should probably pay attention.
And the best way to remember it is there's like a little rhyme that they use. It's if you're under 4'9", it's booster time. Oh. So what a lot of people don't realize, and the whole reason I started the Back to School Bash, was we get calls from SROs all the time because there's kids floating around in the car, not wearing their seatbelt, not in a booster seat. And they're like, I'm pretty sure that this kid should be in a booster seat. Can you come check? My goal was to kind of be proactive so that SROs aren't calling us, and educating parents that your kid should be in a booster seat. That's kind of where the idea came into play, but it still happens, and boosters are required till they're 9 or under 4'9".
That's a lot to remember, I guess, as a parent, but I can see where there'd be a lot of questions there. When does my kid switch over to the booster seat versus the regular car seat? Do you get a lot of phone calls too from people just driving on the road and they say, oh, I just saw this kid walking around in a car?
It happens
stuff like
from
that.
time to time, but not as much anymore. Maybe more so people, like officers, will see it and they'll pull them over. And we have, my sergeant actually is very good about that. If he sees kids, like you can tell if they're standing up.
Yeah.
And to be honest, when I was younger, my little sister was sitting on her knees in the back seat of a car and we got pulled over because the officer said that head is too small to be an adult and they're too tall to be sitting.
Yeah.
So we got pulled over. So I remember that, and officers will see that and they'll pull them over. And if they don't have a car seat, they'll make ways to get them a car seat.
I'm old enough where they just let us
Oh, yeah.
Just
walk
roam
around
free.
in the back seat.
Well, and the other thing with car seats to remember is that they're expensive.
Yeah.
We have parents who come to the hospital that don't have a car seat when they have their baby, and we can't let them leave with their baby not
kinda
in a
makes
car
sense,
seat.
yeah.
And so we have programs in place as well to help those who are struggling and can't afford the right car seat, because it really, you don't want it to be a barrier, and we have to help them get home. And so it's the car seat. It is a thing. It's expensive, and there's not as much education, to your point, on what kind of car seat you need and how to get it installed properly. So I feel like it is all of us working together to make sure these families have what they need appropriately.
And we've actually partnered with Ascension, where we take our information pamphlets up there for new parents when they do the labor and delivery tour. And we have had some calls where they've seen that and they're like, can we come get our car seat checked before the baby's born? So we do offer that as well.
And then how expensive are car seats these days? Is there, I mean, a totally separate car seat for babies and then versus kid who is like 2, then the booster seat, of course. Do you have to buy like 3 separate car seats for this?
So you don't have to. There are convertible car seats that can do rear facing and forward facing, and even some that will change into like a booster seat with the high back. But it's all about convenience. Do you want one that's going to be convenient? And when they're little, everyone wants to carry their baby in their little car seat carrier. And so those are kind of expensive. They can range, $100 to $200.
Yeah,
and there's
I
some
think
that are
so.
thousands of dollars.
Yeah.
Wow. Wow,
that
that's
there's-
crazy.
Yeah, there's
1,000.
some that you can take out and they turn into strollers now.
It's like the Neiman Marcus of kids' car seats.
It's all about convenience.
Yes. Yeah. What makes it easier on mom or dad or grandma getting them out of the car and to doctor's appointments or wherever they need to go? So they can be really expensive. You'll find them a lot, I think, on baby registries for gifts because it's quite the expense. And speaking about like barriers and things like that, plug the United Way a little bit. United Way does a really great job with their Stuff the Bus initiative every year, where community partners are gathering school supplies and they take those directly to the schools. The schools distribute those to kids that they know that are in need. Laura's done a really good job of securing some donations from businesses to purchase school supplies, backpacks, and things like that we'll actually give to families, because for some families and for some kids, it's really important that they go to school on that first day, that they have what they need. It's a pride thing. It's a they don't want to be seen as less than, and it just kind of gives them a little extra confidence. So those school supplies will be given away at the back to school bash until we run out.
Yeah.
So we don't know what that looks like. It depends on how many people show up, but
Yeah, and a big thank you to Redstone Federal Credit Union and MMC for the donations to help us purchase that.
Yeah.
The days of the old Trapper Keeper for 99 cents.
Oh, I remember those.
they are no more.
Yeah, they don't have
They are no
anymore, do
more.
they?
Now, I will say, I feel like school supplies, as a parent, they are expensive, but I do feel like it's balanced out a little bit. I feel like we're having to buy less because so much is digital. Like for my kiddo, she's in high school. Pretty much all of her schoolwork is on the computer. Like we're going to have to buy a few notebooks. We usually send some supplies for the teachers, like Clorox wipes, Kleenexes, hand sanitizer. But the days where you had to have like all the different markers and crayons and all
color
that, like it
pencils
does get a little bit.
They used them one time.
Yeah, it balances out a little bit, I
Graph
think.
paper.
But it can be a barrier to families, especially families with multiple children. Backpacks are expensive, and it all really adds up.
Do the schools, do they usually pay for like the computers or laptop? What are kids using
so, yeah.
today?
Yeah, so if a school is using technology, then that is provided for, at least in the public schools. Then that's funded through taxpayer money. However, I can't speak to how the public education is fully funded, but yes, all that is provided, so families are not required to pay any kind of additional fees for access to computers or things like that.
That's cool. I mean, never would have pictured that years ago.
Right.
And are
Right.
they using like iPads or Chromebooks?
It's a Chromebook.
Okay.
Yeah, most of them use Chromebooks, and they get it signed every year and check it out, bring it back and forth to home. And
That's cool.
yeah, so backpacks are a little bit lighter. You've got the less of the big, heavy textbooks, and it's mostly just on a Chromebook.
Can you imagine if you had to carry the Apple IIe?
Right. Right.
Strap it on your back, head to school.
Yeah, it's crazy.
Those things are huge.
Yeah, yeah.
Computers,
They
I
are.
guess, all used to be huge.
They did.
But not anymore.
No, they're like
Size of a phone.
the size of a phone.
Some
Here's
of
our
us here
computer.
didn't even have that. We actually went to the library. And
We had that. Yeah.
had to.
Yeah.
I remember doing a research
Right.
paper. We went to the
Yes.
library, had to use the
The
card
note
catalog,
cards. Yes.
microfiche.
We didn't have the internet, you know.
There was no
So-
internet.
There was not.
That'll blow some
You had
kids'
to go to the
minds right
library,
there.
that's
Yes.
right.
Yes.
And then to kind of piggyback off of what she said is there's a program through the school called Atlas Program, and we will be collecting donations for that, non-perishable food items, like simple things, so Easy Mac or ramen noodles or SpaghettiOs, things that kids can use to take home that might not get meals at home. The Atlas program lost its funding about 2 years ago, and so we try. I know the SROs do a really good job of filling their pantry, making sure they've got things to give to the kids that need them.
And then the first day of school, because the bash is on August 8th, which is a Saturday. When is the first day of school?
So there's a 2-hour day on the 7th on
Yes.
Friday, and then the first actual day is that Monday.
So
I think.
Is it just me, or is school starting, feels like earlier and earlier each year?
It feels earlier, but I feel like when you're younger, you had a summer break and it just
Yeah.
like seemed like so long. It might be the same because we don't get summers off anymore. I don't know. Being a grown up is.
I think it went by fast.
Yeah,
I do
I have 6
too.
kids at home though, so
Yeah, that's a lot of car seats. Or was.
just one's in a car seat, but
Yeah.
the rest of them
That
are
is a
almost
lot of car
driving.
seats.
I'd rather buy car seats than pay for their insurance though.
Or pay for
Yes.
each of their cars all at once.
Yes,
Can you imagine
absolutely.
that one? Yeah.
Absolutely.
And everything is more expensive today, no matter what. Car seats included. Everything is so high. Man, 6 is a lot. That's a whole lot. That's like you might as well start a school at that point.
I don't know that I'd have the patience for that.
She's raising the next police force.
That's right. That's right. What else is going to be happening at the back to school bash?
Goodness. Well, we're going to do the school supplies as long as they last. We have got our pediatrics team, the Ascension team, the sheriff's office will be there doing some fun things. We have invited other businesses. We have a few other businesses that are going to be out there providing free giveaways, fun games and activities for the kids. And just to note, that is open to anyone. We would welcome any other businesses that want to join us. There is no charge to come and set up a table or a tent. All we ask is that you provide an activity for kids and families to enjoy or a giveaway or something like that. But you're welcome to come out and kind of advertise your business that way and get in front of some families. We'd love to have you.
And we'll have agencies too. I know the United Way will be there. So if a family is there and they want more information on maybe some help that they need or some resources that they'd like to learn more about, or if a family is there, you know, a lot of these kids have volunteer needs that they have for their school or their
They need
program or
community
their club.
service hours.
And so they can also learn about ways they could volunteer as a group, as a family, as a class, also through the United Way. So we'll have lots of agencies there, businesses there. Our hope is that it is just a really fun day, kind of like a party atmosphere. We're kicking off school. We're getting everybody prepared. We're getting them confident. We're getting them ready to go safely and with all the supplies and everything that they need.
Are schools these days, are they building into the programs more volunteer type things to do or trying to educate the kids on volunteering and how important
I feel like there is. I mean, when I was in school, I know I did some volunteering, but I feel like most of my volunteering came through my mother, or, you know, things that I did with her that she was involved in. And I have 3 children, 20, almost 15, and Parker, who's 13 today. Happy birthday, Parker. I mean, there has been, I have noticed a significant, there's volunteer clubs in most of the schools. A lot of your extracurricular clubs have a volunteer requirement. Some schools, Central, I know they have a requirement for all their students to meet. So I do feel like there has been a shift to really trying to teach and encourage children to understand the need and what you get out of it personally and what your community
The
gets out of
value
it.
of serving,
Yeah.
for sure.
and volunteering. Mine all came through the police. No, I'm just kidding. Right now in Las Casas, there's not a high school, right? It just goes up to elementary in that area.
Oakland is close to where
Well, I
we
guess-
are. That's the
okay.
closest high school to that area. It's right down the road from the newest location there. So,
Less
I
than
guess-
2 miles.
yes.
Yeah. When I think of Oakland, though, I don't think of that as being in Las Casas, but realistically, yeah.
Yeah,
it's
and we're
pretty
not all the
close.
way in Las Casas proper. It's a little bit down the road, but definitely on that side of town. But there's not a high school in Las Casas.
The new MMC, I know you said pediatrics will be opening there. How big is that clinic and what all is open right now there?
So right now we have internal family medicine and we have lab and radiology, and then we also have an MMC now walk-in clinic there. Our walk-in clinic that had been in the Kroger shopping center over there at Rutherford Crossing had relocated to that new building. And then we've got pediatrics that will be moving out there. And then we have some space where we might have a specialist or two rotate out there once we kind of identify what the needs are. But for right now, our physicians and nurse practitioners that had been practicing at our Northfield office moved over to the new Las Casas building.
For comparison, is it about the same size as the one on South Church Street?
It is similar to the size of South Church. It's probably...
It looks the same for the most part.
It's probably like... Joey will kill me because I don't know the square footage. I think that...
He's hiding behind the wall.
He probably is. Hi, Joey. I believe it's a smidge bigger than Shelbyville Pike, but it's obviously smaller than the West Lawn location. So kind of in the middle there.
It's cool. They all look similar, with the architecture. It makes it easier to spot, especially if you're new to town or something.
Right. Yeah, I think that was kind of the idea.
Well, and building these campuses, that's what I'm so excited about.
Mm-hmm.
When you mention West Lawn, our emergency department is the 5th visited emergency department in the state of Tennessee. I think last year we saw 99,000, and that's including West Lawn and our main campus. And when you have facilities like West Lawn and you have MMC out there, you have TOA, and now Tennessee Oncology is coming out there, you can be seen at West Lawn. If they present at MMC and they need to be seen, you can get in and out of West Lawn very quickly. It's new, it's smaller, it's nice, it's wonderful. And so to be able to have, mimic that campus in the Las Casas area, it's just such a blessing for the community, because we have people that drive to West Lawn to be seen that don't live out there.
In West Lawn, yeah.
It's just so much more convenient and faster because our main ED is busier. And so now that we're even going to be able to do that more on the other side of town, and have these medical campuses, I just think it's such a blessing to the community that we're doing it in this manner.
Yeah. It's really nice to be able to go back to where people are living. I know at one time it seemed like people, like everything was gravitating towards the center of town, and like everything needed to be in this like city-centric thing. Well, then that just creates more traffic, and as more people move in, you've got more traffic. And so taking medical offices and services out to the smaller communities just cuts down on traffic of people coming into the city. It provides them access to care, especially if a walk-in clinic isn't enough and you need an emergency visit, but it's not a life or death thing. It's perfect to just walk into a standalone emergency, get sewn up.
Get your stitches and
get on your way, So rather than to go and sit in an emergency room that is bombarded with ambulance traffic from major accidents and trauma and things like that, to I don't know. Yeah. I just think it's nice to be able to say, okay, well,
it's a wonderful option.
If I'm having a heart attack, I probably need to go to the main location. But if I've sliced my arm open or something like that, I can go to Las Casas, or I can go to West Lawn, get taken care of quickly, and not just sit and wait while they triage people who are much more serious.
And of course, at that location in Las Casas or that area, you're going to be getting people, I'm sure, from Milton and Watertown and so forth.
Oh, yes, absolutely.
Probably even further out.
Yeah.
We have, with Murfreesboro Medical Clinic, and I'm sure Ascension the same, we have patients that come from all of the surrounding counties. So we get people from Cannon County, from Warren County, DeKalb County. Yeah. So that Las Casas location, particularly that ED, it's going to be really valuable for those people in the more rural areas. Just gives them easier access.
I feel like we're leaving you out at the sheriff's office. Are you getting folks from all over town there too?
Oh, yeah. We go out of town sometimes.
Even take flights to pick up folks.
Sometimes.
Do you?
Yeah.
Have you ever gotten to do that yourself?
No, my husband actually does that.
Oh.
That'd be kind of cool.
Extradition, is that what it's called?
Oh. Yep.
I'll grab all the folks in Florida.
Yeah, you just let me know where you need me to go. I used to be a probation officer for juveniles. So
did you really?
I did, yeah.
What was that
We'll talk about that. It was terrible.
Was it that
It's actually
bad?
terrible. I have a great job. I love what I do now.
I was a juvenile justice case manager. This is why Brandise and I are.
Yeah, we had the same job. I don't know. So Laura and all the deputies and officers that she works with, like what they do, because I saw like a little glimpse of it as a social worker and working in juvenile justice, and they don't get enough credit for what they do, and putting themselves on the line and sacrificing their time and their families. it's a big deal. It's a hard work.
Yeah, I couldn't do it. That or teaching, there's no way I'd have the patience for those things.
No, I'm so glad that there are people built for that.
Yeah.
Yeah.
I couldn't
And
be
I'm
a
glad
teacher.
it's not me.
Yeah, we have a great group of deputies. We've got a
You
lot of
do.
new guys. I don't
Yeah.
recognize half of them when they come in.
Yeah.
But there's a lot of them that, because I do recruiting also,
Yes.
I get to meet them on the front end and then to see them kind of work their way through.
Yeah.
And when they're out on there and I feel this little sense of pride, I'm like, oh.
Yeah. Our last drug take back, I've been doing drug take backs with the STOPS team and Prevention Coalition for Success since I came to MMC. And this last drug take back we did in April, I was like, who are all these guys? Where's my regular people? They've been promoted. And so like lots of really, really good people that care about the community and want to keep everybody safe.
And when y'all do the big drug take back events, are you getting like just wild amounts of drugs? I mean, is it just crazy amounts?
Yes. Hundreds of pounds.
Because, years ago, it wasn't like that. I mean, people, I guess they just flushed them down the commode.
Well,
Stuff you're not
that's what I was
supposed
going
to
to
do.
say.
Flush
And
them
you
or
don't
threw
know
them.
what you don't know.
Yeah.
There's just
Right.
that lack of education because that's what
Right.
I did for years.
Yes, and so we try to educate people that it's not
I
safe
just handle
to
the kids.
Yeah,
That's what I
flush
would
them.
do. That's,
We don't want them to end up in the water. It's
Or with your children.
or with your
Right.
children. And, like we are, not to get on a soapbox, but we have a pretty terrible opioid epidemic right now. And some of this is if you have unused medications from an illness or a surgery, the best thing that you can do is get those out of your home, because Laura could probably speak to this a little bit more. I've just talked to some of her partners. When you're talking about like home invasions and things like that, a lot of it is drug seeking, right?
Yeah, or it's induced because they're on drugs.
Right.
Right.
So
in
we
some
want,
sense.
yes, we want to keep those unused medications out of the hands of people who don't need them. We definitely want to keep them out of the hands of children because kids are kids. So having those out of the house, if you're not using them and you don't need them, the sheriff's office works with DEA and they dispose of those properly. We just want to make sure that, I don't know, that's just a very, I hate to say it's a small thing, but we sit outside for a few hours. We collect, I think last time it was like 375 pounds of drugs.
Wow,
If you
that's a lot.
think that's a lot, that's a lot.
I mean, we think of the size of a pill and how
Yes.
little that pill weighs.
Yes.
Man.
And then the sheriff's office, y'all also have
We
like
have a collection box.
collection that you can drop off. You don't have to wait for.
Yeah. It's right in the front door to the lobby. So if you know
Yes.
where the flagpole is at 940, it's right up there.
Yeah. No questions asked. Just drop it off. Get them out of your house. Don't drive around with them in your purse or your car.
Yeah.
Yeah, and there is a lot of criminal activity out there, like you kind of highlighted there. Folks who are on drugs looking to find stuff they can turn around, I guess, and sell as quickly as possible to have more money to buy drugs.
Especially guns. Please don't leave those in your cars.
Yeah, that's still confusing. Why do people leave guns sitting in their car? I mean, that's just kind of crazy.
I don't want to defend anyone, but I will say I don't carry a gun. I don't have a gun in my car, but I am very forgetful, and I leave my purse in my car
But
all the time.
It's a gun, though.
Backpack. I know. So
lock your car, please.
I do lock my
Okay,
car. Usually my husband reminds me.
Is it unlocked out front right now? Anybody driving by?
I saw it. She brought her purse in. It's in here.
Wide open.
Yeah, but I'm very forgetful. All that to say. So, but yes, please don't leave your guns or your drugs.
Yes.
We're
That's a
gun free,
combination.
drug free.
Gun-free, drug-free. Please don't bring them to our campus.
I was going to
Thank
say
you.
campus, please. Weapon free campus.
I'm always surprised. I look at, because Nashville Metro Police, they release the numbers, I guess, every week of how many guns are stolen out of different vehicles. And man, the number of guns stolen out of cars in Nashville, it's usually higher than the number of guns taken from like houses and stuff.
It's easier to access a car than a house.
Yeah. It baffles me that many people are just leaving guns in their car.
Yeah. And if you are going to leave your gun in a car, they make safes that you can leave
Yeah.
and bolt to your car.
Oh,
Makes it a little
interesting.
safer to keep it in
Since
there.
we're talking about back to school bash and safety, like it might be a good time for you to talk about the SROs that
Yeah.
serve our
They carry guns.
schools.
They do.
so
They do
well.
not steal. They
Yeah,
get
they-
those.
Yeah. We have great
Right.
And kind of
ideas.
and what do they do? I still don't. Thankfully, I just see them walking around at the games. My child has never had to have an interaction with the SRO. I've never had to meet with them. So
Yeah, so obviously their main goal is to keep our children safe.
Mm-hmm.
But kind of on the side, they're there to build positive relationships with those kids so that they have a good idea and understanding of what law enforcement is. I was an SRO for a year before I got into community engagement. I was in an elementary school, which is probably the easiest. You dealt more with parents being bad than, not necessarily bad, but doing things they shouldn't more than the children. Obviously, when they get into 5th grade, that's when they start getting ready for middle school, and it's the little things. But
yes.
I always felt like 5th, 6th, 7th grade are the hardest for kids.
Oh yeah, middle school is just
It's hard.
It's a transition phase.
Yeah.
And I think that's why
Yeah.
they split middle school into middle school and don't just have elementary and high school.
Yes.
Because you have to separate them.
They need some time to grow, to
Mature.
find out who they are, mature. That's a
lot of hormones changing there.
Yes.
And
Yeah.
just,
It's a tough time.
Those early teen years,
Yeah.
definitely the hardest.
That's when they're most impressionable, and that's you hear stories about the SROs there all the time. We have one of our cadets. We have a cadet program. She loves the SROs, and she speaks very highly about how much of an impact they have made on her life. And there's still kids that because I have kids in high school now, I still see some of my former students from when I was an SRO at sporting events.
Yeah.
And it's wild. Some of them look the same, and some I could never recognize. I recognize their parents before I recognize them.
Oh, I still remember. I feel like when I was in high school at Oakland, Go Patriots, that was kind of the first round. I will not say the years.
1792. No, I'm just kidding.
I was born in the 1900s. But I still remember ours, and he was so wonderful. And to your point about the other things they do besides safety is just building. They're almost like another school counselor.
Yeah.
Honestly.
Man, the hours they take in, though, gosh,
They put in they're at every
sporting
extracurricular, every sporting event.
They know every child. It's like a principal, when you're always amazed when you meet a principal and you're like, how is he greeting every child by name? That is so impressive. But I feel like that's how SROs too. I mean, they get to know those kids, their stories, their backgrounds, the family situation, like who's safe for this kid, who's not safe for this kid. It's wonderful.
Little plug when you do your little thank you gifts for your teachers and your counselors and things. You might want to think about those SROs as well, because I
still have some of
plug.
my gifts that people, especially the pictures they would draw me. I have them hanging on my wall in my office.
Yeah.
Yeah. We had when I worked at Rock Springs Elementary, we had a goat award, the greatest of all time, and it was literally like a little statue of a goat that they spray painted gold.
Nice.
And I remember when I got
want that award.
Oh yeah, it was awesome. I was so excited, and I still have my nomination.
Nice.
For the GOAT award.
Nice.
Now, do SROs, do they have their own office?
They do.
Okay.
So some of them have really nice offices, and some of them have really small offices. Just depends. And then you've got, in your high schools, you've got 3 SROs now. So they try to strategically place them so that they're all kind of getting
all
a good
around
area.
campus.
Yeah.
And I guess new schools, they build with a purpose of having an office for the SROs. So
Yeah.
it's a little different now.
They try to give them the ones where they can see, they have the best viewpoint to kind of watch. A little crow's nest, I guess.
That makes total sense.
Yeah.
Just about out of time because I forgot the commercial break, so I got to fit that in towards the end here. Again, the Back to School Bash, that's going to be August 8th, which is a Saturday. It's 9 to 12, right?
It is.
Okay.
Yeah.
There will be
Everyone
coffee.
welcome.
And it's for all ages of kids?
All
or?
age, everybody.
Everybody.
I mean,
Everybody
even
can
adults.
come. Yeah.
If you don't have kids and you want to come out and see what resources we have for the community, we would love to have you out there.
Absolutely.
If you're in the Las Casas area and you haven't had a chance to come and familiarize yourself with us, or you're curious what the campus looks like, we also really encourage all those local residents, if they want to come, and even if they don't have kids, they're welcome to come and check it out and
Absolutely.
and meet us all.
Now,
you
are
can
there
build
going
a
to be...
boo-boo kit too.
I can do what now?
You can build a boo-boo kit too.
Oh, cool.
Yeah.
Is there going to be a picture of what the new standalone ER is going to look like there? Okay.
Yes, we'll have a rendering.
Don't get hurt to where you need an ER
Right.
yet.
Yeah, you'll still have
Not
to
yet,
hold off
not
on
yet.
that
There will
across
be doctors
town.
there, though.
Yeah, there
Yeah.
will be some doctors there.
Good.
And we'll maybe
We'll have a fire truck. We'll have EMS.
Yeah.
We'll
We'll have police officers.
Somebody will
Yes.
help you if you get hurt while you're there.
Absolutely. But we hope that a lot of our community comes out. We're really excited about it, and we hope that other organizations and businesses join us.
We're out of time, but again, Back to School Bash, Saturday, August the 8th, 9 to 12, and that will be at MMC on Las Casas Pike.
That's correct.
Well, thank you for joining us this morning.
Thanks for having us.
Talking with Rutherford County newsmakers about what matters most to you. The WGNS Action Line.
This is Peter Demas, and our family is inviting your family to come eat with us at Demas's restaurant. We're trying to give them a place where they can eat with their family that's not fast food. We want to create an atmosphere where we can sit down and just have a good old-fashioned family dinner. But unfortunately now most people can't do it at home. So, two people are working, the kids' activities, and so what we're doing is we provide that and we make it affordable. Come eat with us at Demas's Restaurant on Northwest Broad Street.
The Good Neighbor Network, WGNS, Murfreesboro, Smyrna, voted Tennessee's top station for excellence in broadcasting.